If you have a concussion, you're supposed to rest. This one is brutal because it's still propagated, and we've known for a number of years now that rest can actually be detrimental to your recovery if done in a prolonged way. So the current recommendation is to have, it used to be to have absolute rest, brain rest. Don't look at a screen, don't read a book, don't watch TV, don't go outside, sit in complete darkness in your room for days on end until your symptoms go away, and then you can emerge and start to try a little bit of activity. Well, like I said, we're finding that this actually makes people worse. The current recommendation from the most recent international consensus guidelines, which is actually now almost 4 years ago, they'll be redoing that in November. But the current recommendation from that guideline is symptom-limited activity within the first 24 to 48 hours. So if you get a concussion, it's no longer sit in a dark room and do nothing. Actually, now the recommendation is to be up and mobile, take it easy, and don't do anything that provokes your symptoms to a significant degree, but don't just lie around and do nothing. You can read, you can do household chores, you should be doing light exercise. You should be keeping yourself somewhat active and not just doing nothing. But the trigger here and the key is you can do anything that doesn't provoke your symptoms to a significant degree. Right? If you're sitting there with a headache and you start reading something and your headache just stays at the current level that it's at, that is not a big deal. You would just keep doing that. So you're not looking anymore for absolute clearance of symptoms before you do anything. You should be engaging in some level of activity even the next day. Rest, like I said, is garbage. It's not based off any scientific evidence. And here are some studies to just kind of prove this point. So Johnson and colleagues in 2016, and here's a quote from their study: there is limited evidence to support the effectiveness of rest as a treatment strategy. Thomas and colleagues in 2015, they did a study where pediatric patients who were told, who were randomized to have 5 days of strict rest actually did worse than patients who were randomized to only have 2 days of strict rest and then were pushed back into activity. So the longer rest was detrimental to recovery. Moore and colleagues in 2015, adolescents who did not listen to their physician's advice to rest, right? Doctors were telling their patients to rest. The kids that listened to their doctors did worse than the patients who did not listen to their doctors. I'm not advocating for not listening to your doctor, but if your doctor's telling you to rest and sit in darkness, your doctor hasn't read anything on concussion in the past 10 years. So do not listen to that advice. Silverberg and colleagues in 2019, advice to rest for more than 2 days after concussion is associated with delayed return to productivity. This study supports, this is a quote, this study supports the growing evidence that prolonged rest after concussion is generally unhelpful. Along that same vein, the new research coming out is actually supporting exercise. Researchers from the University of Buffalo have been studying the effects of exercise on patients with persistent concussion symptoms. So for the most part, symptoms are going to go away in a concussion patient in the first 7 to 10 days. After that, we start to look at this as if it's a persistent concussion symptom. So research from the University of Buffalo has been looking at patients with persistent concussion symptoms, doing exercise, and finding that exercise is generally a helpful treatment strategy for these patients. Over the years, we've actually started saying, well, what if we could actually do exercise earlier and maybe prevent the long-term symptoms of concussion, maybe prevent some of these people from going on to having these chronic symptoms. And what we found is that's actually the case. Early exercise now seems to potentially be protective for concussion, meaning that it helps you get better faster. It gets you back into your life faster, gets rid of your symptoms faster. So here's some studies. Recently, there was a randomized controlled trial that found that a group that was doing subsymptom threshold exercise following a treadmill test, which was delivered at day 4 after their injury, did better than a group that was given just placebo stretching. Anne Gruel in 2016 did a study on adolescents, a large study on adolescents, and found that those adolescents who engaged in physical activity within the first 7 days of their concussion did better than those who didn't engage in physical activity within the first week after their injury. And David Lawrence from the University of Toronto did a study using a survival analysis, and what he found was that for each successive day in the delay to the initiation of aerobic exercise, individuals had a less favorable recovery trajectory. What they found was that if people started exercising at day 1, they actually did better than people who started exercising at day 2. And the people that exercised at day 2 did better than those that started at day 3. So every day you delayed to initiate the onset of exercise actually created a longer recovery outcome. Now, I will say that there was a recent study that found that doing moderate to vigorous exercise in the first couple of days after injury actually prolonged the outcome. So the trick here is don't rest and do nothing, because that will prolong your outcome, but don't do too much, because that may also prolong your outcome. So what you want to do is find that balance. Light physical activity, so go for a walk every day, go for a half hour to 45-minute walk in your neighborhood, do household chores, read, keep cognitively active, do things around the house. You can take a day or two off work, but stay mobile, stay active, because laying around doing nothing could actually make your condition worse. So that's the balance to take.